From the station that's working for you, this is Fox 4 News at 5 p.m.
This is one of the most effective medical interventions in human history, vaccination.
The Kansas legislature passed a bill this week regarding child health care. However, part of the bill is sounding alarm bells for some pediatricians. This is Fox 4 News at 5 o'clock, and I'm Shannon Russo. That bill would let parents choose not to vaccinate their kids based on moral and ethical beliefs. Before, the state only allowed exemptions for religious beliefs. Fox 4's Jacob Sloan is live in KCK tonight with that concern from one key group. Jacob?
Yeah, one pediatrician we spoke with pointed to recent outbreaks of measles in both Kansas and in Texas and said as parents choose to not vaccinate their children, we may start to see more of those. Dr. Brandon Kennedy has been a certified pediatrician for the past 30 years and is now the board chair of the Immunize Kansas Coalition.
We're just trying to do our best and to be the most effective at protecting children against these illnesses. And all you'd have to do is be in my shoes and see one or two of these kids and how sick they are to understand.
He says House Bill 2294 is by and large a positive for Kansans. But new language regarding religious exemptions to vaccinations could be harmful.
I would say probably the majority of the medical community is really concerned.
The bill references a state statute passed in 2021 regarding employer COVID-19 vaccine requirements. The statute says that religious beliefs include theistic and non-theistic moral and ethical beliefs.
That widens the gap for what people can say in order to try to sidestep any vaccine requirements. Look at the Texas measles outbreak. If all of those folks would have been vaccinated, we wouldn't have been seeing the multiple hospitalizations, the childhood death. All of those things were preventable through appropriate vaccination. And we have all the science that backs that up.
He says he can understand why parents might not want to vaccinate their children, but says vaccines have been proven to work.
And I totally validate that people's fear and anxiety around the entire situation. They hear a lot of things and they see a lot of things. And unfortunately, there's a lot of misinformation.
Kennedy wants the state to provide experts another chance to discuss the change in language. But no matter anyone's beliefs, he says he just wants to provide a voice to those who haven't found theirs yet.
My first priority is the kids, because many of those kids don't have a voice. And we as pediatricians, many times have to be their voice. And like I said, what we want to try to do is what's best for them and lowers their risk for health problems and harm.
The bill heads to the Kansas Senate for approval. We reached out to local lawmakers who voted yes to approve this bill. None of them got back to us in time for our story. Shannon.
Jacob